statement of helping our fellow human beings with their pain and suffering through our medicine. We have two distinct product lines at Wonder. One is Figo or RSO, and the other is a line of tinctures. I'd like to start by talking about the Figo. Figo comes in three different types of oil. We have THC, we have a 1-to-1, which is a perfect 1-to-1 blend of THC and CBD, and then lastly we have 25-to-1 CBD. These products come in two sizes, a 3-gram syringe and a 1-gram syringe. Now really the thing about the RSO or the Figo, we will call it, is its versatility. This product can be used in many, many ways. In fact, it's found in a lot of products on your shelves. It can be used in a balm or a salve mixed in by the customer and used topically. You can get capsules, fill the capsules yourself, make your own capsules with any of the three or a combination of the three. You can also use it sublingually, rub it on your gums, underneath your tongue. This is an excellent way to digest this product. What we suggest is you take the syringe, put a small amount on your finger. Folks that are just starting off or have a low tolerance, I would suggest a half a grain of rice. Rub it in slowly on your gum, and then let it sublingually digest for at least 1 minute to 2 minutes. It can also be smoked. However, we don't suggest it using it in a dabber because it is whole plant raw oil. So THC is approximately 60 to 65% THC by weight. That would make it approximately 650 milligrams per gram. So the 3 grams, it would approximately be 1,800 milligrams total in the THC. The 1-to-1 is 3 grams, 1/2 gram of THC, 1/2 gram of CBD, because they're both right about 650 milligrams of each THC and CBD, for a total cannabinoid content of 1,800 to 1,900. The 25-to-1 CBD product is about the same, 600 to 650 milligrams, and then 1 times, or 1 into 25 THC, a 25-to-1 ratio. Now, what we suggest for patients or customers is that if they are not okay with being high, they want to function, they want to go to work, or they just don't like being high, the 25-to-1 ratio is very much non-psychoactive. Very few people have reported being high or psychoactive. This is again good for your first-time users, folks that want to be able to function, or perhaps do this in the morning or the daytime, and then supplement with the THC at the nighttime. THC product for somebody that is okay with being high. Also, I'm sure most of you have heard of the Rick Simpson treatment, or RSO. What that is a 6 to 8 week treatment of high doses of THC. Typically, unless you have a very high tolerance, you would start off again with about a 1/2 grain of rice, rub it into your gums, and then monitor your effects for 2 to 3 hours. And if you're okay with that amount and you're not too high or psychoactive, then later in the day or the next day you can move it up very slowly, working your way up to a grain of rice. The ultimate goal is to get a high tolerance for this, for cancer treatment, and to get up to the recommended dosage of 500 milligrams of THC a day. That might take 10 days, 15, 20 days, but the goal is to do 60 grams in 90 days. Eventually, you're going to be doing up to 3/4 of a gram, which is about 500 milligrams. Your customer will be quite high, but this is something that is necessary. That is a side effect. On the other hand, it does alleviate a lot of the discomfort from chemotherapy, the pain, the insomnia, lack of appetite, certainly the nausea. Really, Figo is a 1-2 punch for cancer patients. One, it really helps with a lot of the symptoms of the cancer itself and the chemotherapy. Number 2, it is shown in studies and testimonials that it has a tendency to shrink tumors, kill cancer cells, and reduce your numbers, your PSA numbers, substantially in many cases. So that is really probably the top use for RSO or FIGO, is a very aggressive cancer treatment. It's also very good for pain, insomnia, anxiety, or just an overall well-being. Now our one-to-one is also very good for a lot of these ailments. It's called the entourage effect. The CBD and the THC are known to work very well together. And as we've found, and I'm sure a lot of you have heard, CBD mitigates some of the effects of the THC, reduces some of the anxiety, perhaps some of the high, and gives a more level curve for the high. So they really work great together, but it will get you high for your customer. So you have to be cognizant of the fact that this is also going to have psychoactive effects, but less so from the THC. The CBD, the 25-to-1, again, is for folks that don't want to be high. CBD is a bit of a different compound than THC, that you don't need great amounts, especially for a cancer treatment. There's a lot of information on the internet, there's a lot of information out there at dispensaries on how much CBD can be taken. Originally, from a lot of doctors, we found that it was 1 milligram of CBD per day for 10 pounds. So in effect, a 150-pound adult would want 15 milligrams of CBD per day. Now, as time has moved on, there's been some research and some findings that for different kinds of cancers, they require a different kind of medical marijuana treatment. A lot of it is up to you and your customer to do this research so you get the latest information on exactly what the best treatment is for your customer. Let's see, anything else on the FIGO that I can think of? Oh yes, the one-to-one currently only comes in a 3-gram form, whereas the THC and the CBD come in 1 and 3-gram syringes. I'd like to move on to our tincture line. We use the same oils that we do in the tinctures as we do the FIGO. The ratios are the same, 25-to-1 on the CBD tincture, a 1-to-1 ratio on the 1-to-1 tincture, high THC on the THC tincture, and then we have an insomnia tincture, which is our latest product. We added 150 milligrams of melatonin to the 600 milligrams of THC. Now what this does is, obviously, it's intended to help your sleep. We have found that melatonin seems to work better with THC than it does just by itself. Let's say you bought it from the drugstore. We've had some great feedback, some great testimonials for really helping out with insomnia, relaxing folks, and getting a good night's sleep. What we did a wonder is we wanted to make it easy to dose this product. A lot of tinctures show you the total cannabinoids, say for instance ours are 600, but they don't tell you how much is in a drop. Well, 1 ounce of liquid is 594.1 drops, essentially 600. Now the math really adds up. It's also 600 milligrams. So each drop is approximately 1 milligram of your CBD, THC, or 1-to-1. So it's very easy to dose and very accurate. THC is 600 milligrams. Our insomnia is THC with 600 milligrams of THC. Our 1-to-1 is 300 milligrams of CBD, 300 milligrams of THC. And then our CBD is approximately 600 milligrams of CBD. Now, with tinctures, also sublingually is really the best way to take this product. In fact, it really is the only way to do it. You can't smoke it. So you take the dropper, drop it under your tongue, on your gums, swish it around for at least a minute to 2 minutes to try to get it to dissipate as much as possible before swallowing the product. That way it bypasses your digestive system, doesn't filter a lot of the medicine out, and it doesn't change the chemical compound of the cannabinoids. There's a lot of information on that on the internet and again at your dispensaries and your personnel. So if you want to take, say, 15 milligrams of the THC, you simply do 15 drops. We really try to make it easy to do accurate dosing, and this makes it easier for your customer to get it just right by having 1 drop again equals 1 milligram. So that is our complete lineup of the Wonder products. I started doing RSO development and manufacturing right when I started Wonder. I saw some cancer patients again have some fantastic results. And then I myself developed bladder cancer. This was 2012. Luckily, I had really good access to these kind of oils. And I did a combination of THC and CBD oils between surgeries. Between my second and third surgery at Stanford, while doing this medical marijuana, my doctor noticed that my tumor had shrunk between surgeries. He said that's not typical at all for bladder cancer. So I talked to the oncologist, Dr. Gill. He's actually the dean of oncology at Stanford, and told him about cannabidiol and THC and medical marijuana in general. He had not heard about CBD. He asked a lot of questions. Where did I get it? How do I take it? Why did I take it? After about a half an hour of consultation with this oncologist, he was very intrigued and very curious. So he wrote me my exit medical directions paperwork, and on it, surprising to me, he told me to take 20 milligrams of CBD by day by mouth, based on how much I told him, on Stanford letterhead. And I believe that's the first major hospital to recommend CBD for a cancer treatment. Shall we say that that document's well traveled? I now have it framed. I'm very, very proud of that. As far as moving forward, we're going to have some more exciting products coming out in some different form factors here shortly. You will see those, of course. Your sales rep will bring samples by and some information. I can't tell you much more than that because we're still under development, but we're always moving forward at Wonder and exploring the best ways to administer this medicine. I'd like to finish this up, most of all, thanking all of you for being part of this. You are truly helping your fellow human beings from their pain and suffering, all the way from the growers to the extractors, to the distributors, to the manufacturers, to the sales reps, to the dispensaries, and finally to your customers. You are doing something that is making a difference in people's lives. You are helping people, sometimes reversing very, very serious diseases. And it's the greatest thing I've ever done. So I will wrap it up by again saying thank you, and God bless.